Ahmed Kalebi, founder and group managing director, CEO, and chief consultant pathologist at the Lancet Group of Laboratories East Africa, as well as a lecturer in the Department of Human Pathology at the University of Nairobi. Thank you so much for joining us tonight, Daktari. Let's begin on where we are now. You know, there's fears that we are heading to a third wave. We could be peaking in 4 to 6 weeks. You know, as you take stock and take a look at the year that has been, where are we?
I think we are most likely heading to a third wave. If you remember, the first case was reported on March 12th. That's when it was announced by the Ministry of Health. Although personally, I think we had a few cases preceding that.
Right.
And then for a while, it was what we call a lag phase in the epidemic, in the pandemic in Kenya. And then we started picking up in May, and the peak actually happened in July. So you're looking, that was the first wave. In other words, the numbers were rising up. Then in July, it started falling down, and we started celebrating. By August, it had gone down. Come September, it started picking up again. And in October, the numbers started rising. And in fact, that was even a worse wave, the second wave, because it started going up. And by October, November, I think that's when we had the most number of deaths. Prominent people were dying, and there was a lot of fear. And then the government took measures. People became a bit more vigilant. And in December, the numbers crashed down. We are worried that when the schools reopen, when businesses reopen, people going back up country, things will really be bad. I was one of the guys who was really fearing and keeping my fingers crossed. But surprisingly, end of December, January, and February has been really, really good. Most other countries worldwide were suffering. If you remember, a place like South Africa, UK, even our neighbors in Uganda. But for some reason, and especially because of the interventions that were done by the Ministry of Health in November, December, the presidential announcement restricting movements, we kept our numbers down. And the schools have not really been a factor. So we have not gone into a third wave yet, but in the last 2 weeks, from my observations, and you can see that from the numbers, the positivity rate has started going up. Because the whole of September, actually the whole of January, February, our positivity rate was below 5%. But came the last 2 weeks, the numbers have gone up above 5% for quite a number of days. Today it was 3.2%, but yesterday it was 6 point something. Actually, this week we had the highest positivity rate, I think 7 point something. So we're actually looking at, when the positivity rate is high, it means the number of people who are actually infected and who can potentially infect others is also higher. And with that kind of thing, it means if more people are interacting, the transmission will be higher, and we should be expecting a third wave. I think KEMRI actually predicted from their modeling that the peak of the third wave will be in March. And we might be seeing a peak of a third wave. My only hope is that it won't be such a high peak, probably just a low peak, and then it will sort of burn out like wildfire just burning out in a bush. Right.
So what does this mean for our recovery? You know, we expect the vaccines in the country soon. So, you know, what do you think that will have an effect in terms of us trying to get out of?
If I could be very honest and brutally honest, there's no much in terms of the vaccine coming. I mean, the vaccine we're getting is, look, South Africa got only 1 million doses of the AstraZeneca vaccine, which is what we are expecting. Ghana was the first country to get it under the COVAX initiative, which is this UN global initiative, of which Kenya is part of, and they got it last week, only 600,000 doses, which probably will be enough to vaccinate about 300,000 people. I don't think in Kenya we can get more than 1 million, although the Ministry of Health says we are expecting 4 million out of the first 24 million. So assume we even get the 4 million. Probably to vaccinate about 2 million people. 2 million people is a drop in the ocean because for you to achieve what we call herd immunity through vaccination, you should aim to vaccinate at least 70% of the population. That's 35 million people, at least let's say 20-something million people, if you're talking about adults. I'm not seeing that happening. So the vaccine that we're going to get will probably just be for the most vulnerable and the people who are most likely to infect more. In others, they are high risk to infect others, and the ministry will really have a headache, and I don't really envy them to decide who gets the vaccine. For the general common mwananchi, for you and the rest, probably I might get it because I'm a healthcare worker, I don't know, but for you and the rest, I don't think they should be pegging their hope on the vaccine, not anytime soon, because the vaccine is actually very limited. We are importing from India, which is where it's being manufactured, and they said they only have 12 million doses for the first round. For Africa, now, even if they distribute it to all the African countries, even if you got 5 million or 10 million doses, it still won't be enough. So we really have to go back to adhering to the measures that have been shown to work. Wearing masks, washing hands, avoiding crowding, and basically common sense. What has been happening and has worked before the vaccine comes. But even if the vaccine comes, it will be at least another 1 year to 1.5 years before life goes back to normal. So we are in for the long haul with this.
So it's literally going back to the basics that will at least spare us a very detrimental scenario.
100%. Because right now, we estimate about 40 to 50% of the population has been infected.
Okay.
That is based on what we call serological studies, including from our lab and data published by Cambridge. So assume 40% or 50% of the people have been vaccinated. The problem is we have these new variants, these new mutated variants, which can cause reinfection. And we have seen that in places like Brazil, where they even had 66% of the population infected, but then they got a second wave, which even caused more lethality. So really what you're looking at is we cannot say just because we have a high number of people infected, they have immunity or they have sufficient immunity, because the immunity might not last. So even if people have been infected, they have immunity, unless we get the vaccine, we are stuck with this for a while. And it might not be as bad as before because more people have immunity, so it prevents the infection from spreading quickly or spreading widely, but you never know which pockets will be infected out of the community. So everybody has to be vigilant because it could be you. Unfortunately, if you look on the TV, actually today I was in a wedding in Nakuru, and nobody is wearing masks. And one of the MC actually had to stand and say, guys, can you please put on your mask or the police are going to come? But there's no police. Look at the political gatherings. I was looking at the news just before I came in. I mean, it's crazy. I mean, I think the politicians actually should be starting their rallies by saying, can everybody please put on your masks? That would be a good initiative.
Should they be even having those rallies to begin with?
Unfortunately, this is life, and we have to adapt to it.
Right.
Perhaps the constant reminder will be a helpful thing. Yeah.
So you mentioned variant because there's concern. Even if you've gone through the disease, you've built up antibodies, there's the South African variant. So there's no guarantee that those antibodies will be able to fight against that new variant.
Actually, the studies, the most recent studies that are being looked at are showing that these mutated variants can cause reinfection and they are more transmissible. So they can infect more people and infect people faster. And we just have to know that when you have immunity, actually I need to explain about what immunity is all about. When you get a viral infection, your body recognizes it and develops antibodies that actually attack that virus based on its structure. So the same way I recognize you as Victoria based on your features, your hair, your face. But what happens is a mutation, you change your appearance. So let's say your nose becomes bigger, you become different color, your hair becomes, let's say, afro or maybe some dreadlocks. I might not be able to recognize you. So if I was the antibody and you mutated, you'll just come in and cause havoc. So you escape the immunity. If I was a policeman and I was supposed to be protecting a particular place, like the body for that case, I won't be able to recognize you. So basically what it means is that the virus changes and it can cause reinfection, and that can actually be lethal. The fortunate thing is most of the reinfection are not as severe as for people who have had the infection for the first time. And also for the people who have had the vaccine, they might get reinfection, like with the AstraZeneca vaccine. It has been shown that the South African variant is not very, very effective to prevent mild to moderate infection. It can actually prevent severe disease, but not prevent the milder infection. But at least it's still protective, but not as effective. So for a while, until this virus completely dies down to become like what you call seasonal flu, we just have to know that we are all exposed and it's dangerous for everybody. And
there's concern because even if you get the vaccine, you're at risk of even passing it on to someone else.
100%.
So you have to wear a mask still.
100%. If you get vaccinated, you are protected from high level of infection, you are protected from getting severe disease, but you can still get the infection. It will last for a very short time because what happens, the virus goes into the airways, particularly the nose, and it will multiply in the airways. So if you have immunity, your body will mount an immune response. But it takes a few days for it to mount an immune response, at least 2 to 3 days. And by that time, the virus has multiplied. And you are busy talking and spreading it to other people. So you can actually go and infect people who are more vulnerable, and they might suffer more. Yeah.
So how do we deal with this moving forward, and just kind of showing people the seriousness of this virus being very real, still a threat, amidst pandemic fatigue? Like you said, you were at a wedding where people weren't wearing masks.
I think people just have to constantly remind themselves that it can be any of us, and you don't know who is going to get the severe disease. Just today we lost somebody in Kibra who was buried, had traveled out of town, came back, and within 3 days he was sick and died. So when people need to be reminded that this is a lethal disease. There is high mortality, and it can be anyone. And because this is a virus that can be easily transmitted through the air, you really want to avoid being in a closed environment for long without masks. You want to ensure that your social distances, go around with your meter, at least 1.5 to 2 meters if you can. Try as much as possible to restrict your movements, keep a healthy diet, and avoid all the comorbidities that can make you severe. So if you're a diabetic, control your blood sugars and the rest. We have to be as vigilant as we were when we are in the panic mode back in May. Yeah.
I know there's concern about once the vaccines land, just how it's going to be distributed, because when you look at some of the host facilities that will be doing the inoculations, more than half are private or faith-based. And so they will need to charge for something that people thought would be free. How is that going to be managed?
According to the ministry, and we've been in discussions with them, including myself in the private sector, among the doctors, the idea is for the vaccine that is free under the COVAX to actually be distributed free to the public.
Okay.
But remember, for example, for healthcare workers, quite a number of them, actually, if you look at the private sector, contributes more than 60% of the workforce and the healthcare in this country. And those are guys who need to actually be protected, vaccinated. Now, if that's going to happen, it means the vaccine might have to be distributed to them. But at the same time, even if the private sector was to import the vaccine at a low price, negotiated price, they still have to charge for, because remember, it's not just the vaccine itself. There is what you call the cold chain, the logistics. There is a needle and a syringe to give with it. There is a swab. People still have to wear PPEs, and there's so much other additional costs, what we call overheads. Yeah. Now, these overheads have to be covered. So for the private organization, whether it's faith-based, not-for-profit, and for-profit, there has to be a charge to it. But what the ministry has said is that they will regulate the cost so that there is no exorbitant markup and profiteering out of it. But of course, the charge has to be meted on the original cost of the vaccine. Even for the government, I think it will be a challenge, because just remember, like for testing was supposed to be for free, yeah. But places like Cambridge had to charge for it because there are additional costs that were not budgeted for. So unless the government actually gets the vaccine and sets aside money for the people who will be administering the vaccine and the other things, even in the government sector, it might be a challenge if they don't factor in the additional costs.
As we wrap up, what are your final words, in terms of what the next few months of recovery will look like? We're not going to win the battle of no masks, at least for a while, but what's your final parting shot?
We have to adapt to the new normal for a while. The vaccine, to be honest, is not going to come soon in sufficient numbers. If you look at countries, even for example, like Israel, yeah, which have the highest vaccination, they are only at 50% so far, and it's such a small country. UK is approaching 30%. Countries like Germany, most countries in Europe, they are hardly even at 10-20%. So do you think we'll get to anywhere close to 50% this year? It's not going to happen. So for you, common mwananchi, for everybody out there, let's know that the vaccine is not coming soon. We just have to continue living our lives and try to adjust to it to a new normal. Masks are the most important factor, and avoiding crowding and the social distancing. These are things that I feel we need to constantly remind ourselves. People who are in position of authority, whether you are a teacher in a school, whether you are a policeman standing somewhere, I'm sorry to say this, but when I was walking into Citizen, people, familiarity breeds that kind of complacency. Mm-hmm. So you need to keep reminding your co-workers, hey, please put on your mask. We need to keep reminding ourselves that, and we get used to it, at least not to drop the mask for the next 1 year or so.
Wow, social responsibility has to prevail at least for the next few months to a year. Thank you so much, Dr. Kalebi, for your time and insights. And keep the conversation going on social media, #CitizenWeekend. Much more ahead, including